Did you know that a spot has a 6% chance or thereabouts of turning into a scar? So today's video is all about scarring prevention. Hi, I'm Dr. Sam. For those of you who don't know me, I have coached thousands of people in my Harley Street clinic to bright, clear skin, and I'm here to help you do the same. Now, acne scarring is miserable. It's hard to treat. It requires lots of expertise because there's no one-size-fits-all treatment, and it can be expensive. So much better to prevent it than to have to treat it. So in today's video, I want to give you 4 easy to implement steps, some of which you can start today so that you don't have to suffer. Now, just to say before we start, when I say scarring, I don't mean the flat dark marks that can be red or brown, post-inflammatory erythema or hyperpigmentation. I mean scars where there is a loss of collagen in the dermis and it's a visible indentation on the surface of the skin. And there are different subtypes. There's ice pick, which is jagged with a narrow opening. There's box scars, which have kind of carved out edges and a flat base. And there's rolling scars, which are more sort of gentle undulations on the surface. So all scars equal a loss of collagen. Now, there are different causes for scarring, but for some people, they have a genetic predisposition, which means that whether they have inflammatory acne with redness and swelling, or comedonal acne, which looks quite quiet, they are at higher risk of scars developing. So let's start with scarring tip number 1. And you may not be surprised, it is use a retinoid. Now, we know that these magical ingredients, and it's a big group, whether non-prescription or prescription, that influences so many aspects of the pathophysiology of acne, so how it starts right through to the consequences of having it. And one of the key things that they do is to influence collagen, and they do that in 2 ways. One is by reducing the breakdown because they inhibit a group of enzymes called matrix metalloproteinases, and they secondly stimulate production of new collagen or neocollagenesis because of their influence on the humble fibroblast. So retinoids are absolutely pivotal to both treating acne, treating the sequelae, the consequences, and also in terms of maintenance and prevention of ongoing further acne. And it's in this instance where I'm worried about scarring, or there's some early evidence of scarring, where I'll often titrate the strength of the retinoid up higher than is necessarily required to control the acne process. Because I think particularly with a broad spectrum retinoid like tretinoin, the gold standard on prescription, a higher percentage of tretinoin I think is likely to nudge towards improving the body's own repair mechanisms when it comes to healing scarring by itself. So it's certainly one of those instances where I might have control with something like adapalene, but I'll graduate the patient onto a more potent broad spectrum retinoid to get those extra benefits. Scarring hack number 2 is take existing scarring seriously and seek appropriate medical help with a dermatologist. Now, this is especially true for nodulous cystic acne, which is the deep inflammatory kind, which we know is causing inflammation in the dermis and is much more likely to lead to scarring long term. So this is not something to mess around with lightly. This requires systemic treatment. And as I say, usually we're thinking about isotretinoin orally or Accutane or Roaccutane. There are obviously instances where that's not suitable, but it's certainly where we tend to think treatment is headed when we see this pattern of disease. But even the humble tetracycline, the group of antibiotics that we're often reaching for when we see moderate to severe inflammatory acne, are helpful in preventing scarring because aside from their antibacterial effect, they also influence matrix metalloproteinases. So I'll often use them in a patient where I can see that they may well flare, that things may get a bit more flamey and fiery before they get better, particularly if I see a sea of comedones in the lower face and I know they're likely to get worse before things improve. I will often use oral antibiotics to minimize that flare, that inflammatory surge. And I think that ultimately that leads to less consequences in the skin as well over time. Acne scarring hack number 3, please, please, please do not use physical exfoliation to try to treat your acne, especially if it's inflammatory or in fact even if it's comedonal, there's just no place for physical exfoliation. And it's an irritant, but more importantly, invariably, if you have pustules, which are the red ones with the white heads, if you use a physical exfoliant, you're going to dislodge the top of that blemish. You're going to increase inflammation. That's going to increase post-inflammatory hyperpigmentation and potentially increase the risk of scarring. Overall, I think acne must be treated as though you have sensitive skin. So staying away from unhelpful irritants that don't really help the actual disease process, but might well inhibit the general healing and resolution of the consequences of acne should be avoided. In fact, I'd even go as far to say as those with acne should be treated as though they have sensitive skin and their skin should be handled accordingly. So no friction, please. That's a big part to play in maskne. So I think of an exfoliant that's got physical particles as really being a form of friction, so not helpful. And generally just treating the barrier with great care, particularly in context of using actives. So number 4, please, please, please do not pick or squeeze your spots. I know that there is a strong compulsion to do this. In fact, one of my team and I were discussing exactly that today, how hard it is to leave a red bump alone, particularly when it's throbbing and it's in your lower face and you can feel it when your skin is moving and you're talking and things. But honestly, the changes in the skin as a consequence of squeezing or picking, I can see them. I can tell when someone comes to me in the clinic and I look at their skin. I know when, a bit of this has been happening because it just tends to drive the inflammation lower into the skin. Guess what that means? More hyperpigmentation, so more persistent dark marks. And we all know they cause as much pain and suffering as the acne spot itself practically. And yes, you're driving inflammation deeper into the dermis. And that, of course, is where you're going to get that collagen loss. So please, please, please do not pick and squeeze. And know your own time of weakness. Know when you are likely to fiddle with spots. I mean, I see patients sometimes, merely the question, do you think you squeeze them a little bit? It's almost like a subconscious desire. They feel the need to almost touch and feel and check in with the skin. So this can often happen when you're concentrating on something else. There's clearly some sort of a relief that comes from fiddling with the skin. So just be conscious of your own time of weakness. Keep the weapons short. Do your routine at night in a very efficient way. Get your makeup off, do the routine, and then go to bed, and do not sort of linger at the mirror, playing fun and games with your pores. An important subnote on this one is that I think a lot of the discomfort and drive to fiddle with the skin comes from a lack of hydration. And a lot of people with blemish-prone skin are nervous of using moisturizers. So they're whacking on the spot cream, but they're not sort of balancing out the drying effects with proper hydration. And of course, if the skin gets dry, uncomfortable and sore, it's a constant reminder there's something there. And again, it's so common then just to kind of have the hand drift back up to the face when you're not focusing on what you're doing. So please, please have 2 moisturizers on the go if your skin is up and down in terms of how oily it is. A good day's one for when the skin is quite calm and well hydrated, and a richer one perhaps for night time. But ultimately, keep your skin comfortable. So the good news is, though, that 33% of acne scars will improve spontaneously over the course of a long time, about 3 years. But if you're in a rush and you want to give things a bit of a nudge along, then there are lots of different treatments available to help with acne scarring. But I would highly, highly recommend that you see an acne scarring specialist, someone like Dr. Batali at our practice or Dr. Lim over in Australia, who really do understand all the different tools in the toolkit and really know how best to combine treatments, because it's rarely a single treatment is going to sort things out to give you the best possible results. So I hope that was helpful today, guys. I hope that gave you some tips that you can take action on immediately, and perhaps if you're in that more severe category, give you a nudge towards going and taking care of yourself and seeking out expert help. Remember, I'm here to support you and coach you to bright, clear skin. And if you know someone who'd benefit from seeing this video, please share and spread the word. Bye for now.